A very good morning to Dr. Tan. So today, my group members consisting of Gan Jesse, Nurul Alia, and myself, Divya Sole, we will be presenting on the different dietary questionnaires as well as techniques for the purpose of assessing the dietary habits and intake of the population. So this would be the table of contents for our presentation today, as well as our team members. So first of all, I would like to explain on what exactly is a 24-hour dietary recall questionnaire. Now, this is a very important tool for dietary assessment that is used to obtain detailed as well as all the necessary information regarding the complete list of foods and beverages that are consumed in a given day in the past 24 hours by the respondents. So how exactly does this 24-hour dietary recall questionnaire work? So basically, details from the patient or the respondent will be obtained in the form of a structured interview. And the purpose of this is to capture the necessary information about the food and beverage products that have been consumed in the past 24 hours. So this is typically from midnight to midnight the previous day. Some of the unique key features of this 24-hour dietary recall questionnaire is that it consists of an open-ended response structure, and this simply means that whenever needed or necessary, this type of questionnaire serves to prompt the respondents to provide a more comprehensive as well as an in-depth description of all the food and beverages that they have consumed in the past 24 hours. So let us take, for example, a respondent is explaining that they have consumed probably a chicken sandwich for dinner in the past 24 hours. Thus, a trained interview, which can be is usually a healthcare professional like a nutritionist or a dietitian, would ask further questions such as the methods of preparation that is being employed, the ingredients used, and many others. So next, I will be explaining about the various functions of this 24-hour dietary recall. So firstly, we are able to yield a lot of information on the total amount of each specific food and beverage that is being consumed in the past 24 hours. The next function of this 24-hour dietary recall question is that these 24-hour dietary recalls can be used to describe a population's intake as in what they eat. So collecting a recall for at least 2 non-consecutive days will allow application of various statistical techniques. And the purpose of this is to estimate the usual dietary intake distributions in a group. Furthermore, 24-hour dietary recalls can also be used to examine what is the relationship between diet and health and also various other variables. And these 24-hour dietary recalls can also be used to evaluate the effectiveness of an intervention study or to also change or modify diet. Next, what are the limitations of this 24-hour dietary recall? The thing about this 24-hour dietary recall is that it requires a considerable amount of time, which is approximately 20 to 60 minutes for the entire process to be completed. And also, the requirements of this 24-hour dietary recall may actually limit participation to some groups of individuals. Thus, this leads to potential selection bias. And the next limitation is that now because this 24-hour dietary recall, actually it's a single administration is unable to account for like a day-to-day variation, 2 or more non-consecutive 24-hour recalls will be required in order to estimate the usual dietary intake distributions. Thus, multiple administrations will be recommended in order to examine diet, health, and other variables. So next, the next dietary assessment technique that I'll be talking about is the food frequency questionnaire, or what is known as the FFQ. Now, what is this? This is a questionnaire that consists of a finite list of food and beverages, or F&B, with different response categories to indicate what is the usual frequency of consumption over the time period that is queried. Now, having that said, the prime purpose of this food frequency questionnaire is to obtain the frequency, as the name suggests, and in some cases also information about the portion size, about the food and beverage that is consumed over a specified period of time. Now, this can be typically the past month or even year. How exactly does the FFQ work? So the usual portion sizes for each food and beverages will be asked separately. And in addition to foods and beverages, food frequency questionnaires also inquire about the frequency of intake and also the dosages of commonly consumed dietary supplements as well. So alternately, the portion sizes can be combined with frequency information from the respondents. For example, how often do you actually eat half a cup of rice? So some FFQs also include the portion size images in an attempt to actually enhance the reporting accuracy of the respondents. But as far as the FFQs are concerned, to assess the total dietary intake, the number of food and beverages that are queried typically ranges anywhere between 80 to 120, and very commonly, it is usually 126 items. A unique and key feature of the FFQ is that FFQs are usually self-administered in the sense that the respondent can fill it up on their own without any assistance. And interviewer administration is usually done very occasionally. This is in some special cases, especially when the respondent's educational level or literacy is very low. So next, what are some functions of this food frequency questionnaire? So they will help to provide information on the consumption of the list of food and beverages that they've consumed over a specified period, which is usually a month or a year. Now, depending on whether this portion size is determined, information can actually represent usually the frequency of consumption or even total amount that is usually consumed. And these FFQs, they may be actually better, way better than short-term instruments such as 24-hour dietary records that I've explained previously when it comes to assessing dietary intake of episodically eaten foods. The reason being, they will attempt to directly capture the usual dietary intake over a period of time. Next, food frequency questionnaires are sometimes used to describe a population's intake when it comes to cross-sectional studies. However, this is not recommended because of their large systematic errors or bias that is known as the measurement error. Moving on, food frequency questionnaires are sometimes used to evaluate effectiveness of nutritional interventions in order to change or modify diets. And the next function would be the data that is obtained from the food frequency questionnaire can actually be linked to a database in order to yield information about the total dietary intake. And furthermore, if this data is linked to a nutrient composition database, hence nutrient intake can also be determined. Next would be the limitations of the FFQ. They contain something known as the systematic error, which is also referred to as the measurement error. Now, this error can be at least partially mitigated through appropriate statistical modeling, which means using a less biased dietary assessment method as a reference instrument, and also through energy adjustment. Another limitation would be detailed information and specific information about food preparation, specific food and beverages consumed, the brands, and even contextual information about the intake of food and beverages is lacking. Now, because the food frequency questionnaire is composed of a pre-specified food list, any single food frequency questionnaire may not actually reflect the eating patterns of a given population because the eating patterns change over time. Thus, the performance of a particular FFQ may not really reflect its performance in different populations or different groups of individuals. So that is all for my presentation. I'll pass the floor to the next group member. Thank you.
Hi, I'm Nurul Alia. So next, I'm going to present the third dietary assessment method, which is food diaries. So what is food diaries? Food diaries is also known as food records or diet records, and it is a prospective method, which is an observation which occurs in the present, and it is also known as a short-term method, whereby all the details of food and drinks consumed by the individuals or respondent is recorded by themselves. And what are the functions of food diaries? Food diaries is to assess the individual current dietary intake, and also it is including time of consumption and variation in daily life routine or daily life diets of the respondent. Next, it is to determine estimated food diary, or it uses household measures to estimate amount of food they consume, or also for with food diary, they are using weighing scale to weigh their own food. Next, we are going to look into the strength of the food diaries. Firstly, it provides a detailed data on all food and drink consumption and portion of size descriptions. If the completed, thorough, and nutritional supplement use is assessed, it provides a very detailed and thorough data, resulting in a good estimates of short-term total dietary intake for and total nutrient intake for that individual. And as a result, it will provide or produce a better assessment for that individual. Next, the presence of the collection of contextual information. For example, there is the meal timing, the location, the brand, and also if there is a TV or device on, or with whom they eat with, all the data is there. Next, the data that I said before can be used to answer a variety research questions through various analyses. And that is so helpful for the professionals to assess what they have been recorded. And lastly, it is easy for the respondent to recall their dietary intake. Next, we are going to look into the weaknesses of food diaries. Firstly, it is not suitable for retrospective study, which is past exposure, because the individuals or the respondents will tend to forget what they have to recall. Next, it is a long-term dietary intake, or the measuring intake of irregularly consumed foods would be labor intensive, because multi-day diaries would need to be collected multiple times over a year period. Next, it has a high potential or high risk of low.
Explaining on the observed food consumption technique. So from the name itself, we know that it involves the direct observations on the dietary intake of an individual. So what is the function of this technique is that it is often being used to validate a dietary assessment method. It means that it is being used to observe or to see how accurately the dietary record is being self-reported by the individual itself. For example, if that individual mentioned that they consume a lot of fruits and vegetables, so through these observations, we can see that are they really consuming that much of fruits and vegetables? So for a second thing, eating behaviors. For example, what are the food items, what are the portion size being consumed, or received or given away, all these dietary details will be noted down during the observations. So this technique can actually access the energy and nutrient intake of the total diet, and what are the specific nutrients intake on the plate, and what are the foods that are not being consumed frequently, and also can observe the dietary pattern of an individual based on the meal composition. Now, moving on to the next. So, how this technique is being conducted. So, the researcher will observe the participants directly on what they are having on their plate, and also note down their eating behavior during a defined time period. For example, during a school lunch. So, probably the researchers will observe one of the students on what they are having for their lunchtime, and also what are the eating behavior, like how much of food portion is being consumed during their lunchtime. And the second thing is that the observations will be taken place over a relatively short period of time. Probably 1 hour of lunch break. It can be up to 2 hours, 3 hours. But there is also research study reported that they have done 12 hours of continuous direct observations on the participants' dietary intake. So, moving on, the limitations. So, it is not feasible. It is not a feasible method to obtain the habitual diet data of an individual. As I've mentioned just now, these observations only carry out for a short period of time, 1 hour, or it can be up to 12 hours. So you can only observe one meal at a time. It is not like food frequency questionnaire, FFQ, in which FFQ can observe what are the foods being frequently consumed in few months or in 1 whole year time. But for these direct food observations, it can only observe one meal at a time. So it is not able to obtain the habitual diet data. Second, it is highly intensive for researchers and therefore expensive, because the researchers have to be observant for that period of observations on what food is being consumed and what are the brands, what are the portion size, everything. And the third one is it can practically only be done in settings like canteens or school dining hall, and it is limited to specific times that individuals can be observed. So, dietary assessment is an evaluation of food intake and dietary pattern of an individual. So, this is the overview of all the dietary questionnaires and the techniques that we have explained in the previous slide. So, we have explained about the function and the limitations of all of it, but now we are going to look through on what are the differences between all this technique and questionnaire. So, all of these methods can actually be separated into two groups according to the time of the food consumption is being recorded. So, if the method involves the diet is recording the diet at the moment of the food is being consumed, it is prospective method. So here we have observed food consumption and food diary technique. So this method actually is accessing the current food intake. So if the method is involving a recall back on what food is being taken, it is retrospective. So we have 24 hours dietary record, FFQ, and dietary history. So this method measures the food intake from the past. So let's look at the prospective group. So the difference between these two is that observed food consumption is done by researchers themselves or the nutritionist, and food diary technique is done by the respondent themselves. Let's look at the retrospective group. So 24-hour dietary record needs the respondent to recall what they eat for the past 24 hours. So it's very different with FFQ and diet history, because both of them are involving the respondent to report their consumption or their food intake for a few months or up to 1 whole year. So FFQ is more on reporting the frequency of consumption of certain food group. Dietary history is more on providing very detailed amount information about each food. 24-hour dietary record can capture information on intake pattern, preparations method, and place of consumption. FFQ estimate portion size, consider as semi-quantitative, and certain food group consumption. Dietary history provide details of meal pattern and usual food intake. So for 24-hour dietary record, it adequately represents the habitual intake, because 24-hour dietary record only record the food intake for the past 24 hours, which is not enough to represent the habitual intake of an individual. Unless multiple 24-hour dietary record is being done, then only it can represent the habitual intake. So FFQ and dietary history, they can represent habitual intake because they are reporting on the food consumption that is based on a few months and 1 whole year. So that's all from us. Thank you.